Hey everybody, Dennis here from Respiratory Sensei. You may know me from LindseyJones. Today we're going to do the shunt formula, and here it is. And then, of course, to do that formula, we also have to do this formula. And then we also have to do this formula. And then, of course, we also have to do this formula. You know what? I'm not doing any of those. And neither are you. All right, let's dive into the shunt formula, also called the percent shunt formula. And this will be interesting to respiratory therapists who are getting ready for their examination and practicing in the field, particularly if you're practicing in ICU, but this is also true for nursing and physicians who want to take a different perspective of their patient in ICU. Now, let me just show you again. Here is the percent shunt formula. And again, we're not going to do this formula. It's too complicated. We are very prone to make a mistake. But keep in mind, I want to just show you that there's a dominant number in there, and that is in the numerator and the denominator, you'll find that there is the A to A gradient. And that's because the A to A gradient dominates the essence of this formula. Now, there are some other numbers, but you'll find that they're very, very small. We have the C to A to VO2, that's the oxygen content difference between the artery and, of course, the venous system. And then, of course, we are timesing it by a constant that relates to the amount that's dissolved in the plasma, and that's where we get the 0.003. But remember, we're not going to do that formula. We're going to do something very different. I want to show you how that works. But it's going to focus on the fact that the A to A gradient, the difference between what is in the alveoli in terms of oxygen pressure and what's in the artery oxygen pressure, that's going to be the key to solving this problem. Now, that means you might have to do the A to A gradient formula, and that means you might have to do the PaO2 or the alveolar oxygen tension formula, and I've got that covered in another video that I'll connect here. But once you have the A to A gradient, then you're home free. It's just a couple of steps, and we can figure this out. Now, before we do that, I do want to just mention one other thing. Well, let's talk about what the shunt or the percent shunt that we're calculating actually is. And so each of you, as you sit there, whatever you're doing, driving a car or watching this in your bed, whatever you're doing, your heart is beating and it's pushing blood through what we call the pulmonary vasculature. This is the pulmonary vessels all surrounding the lungs. And then hopefully every single hemoglobin, every single part of your blood is going to what's called an alveoli. It's coming very, very close. Every time you take a breath in, you fill your alveoli with oxygen, these little tiny balloons. And then blood comes so close to those alveoli, there's a membrane called the alveolar capillary membrane. And then oxygen is jumping from the membrane into the blood. So what we like is that the blood is coming close enough to the alveoli to participate in what we call gas exchange. It's picking up oxygen. And all of you right now, if you're in good health, you're picking up oxygen from nearly every alveoli. And in other words, every portion of your blood is touching an alveoli. I say every? Well, not every. In fact, you're perfect, but not quite perfect. So about 3 to 5% of your blood manages to get through your pulmonary system or your lungs without touching a functioning alveoli. In other words, without picking up gas or participating in gas exchange. Technically, that means you have somewhat of a shunt right now, even if you're normal. And so how much are you shunting? Well, if you're normal, you're shunting 3 to 5%. In other words, 3 to 5% of your blood is not participating in gas exchange. What we worry about is when somebody's shunt goes to 10% or 15 or 20 or 30. Now, if that happens, it means that there's something wrong with that matchup between the alveoli and the pulmonary vasculature. What it could be lots of different things, but there is a problem there. And the problem is probably related to some kind of lung disease. Could be any number of things. So we're going to take a peek at how to calculate the percent shunt on somebody. Now, the key I want you to remember is that we're going to look at the A to A gradient. We'll do that here in just a minute. But we're going to calculate this percent shunt. We're going to add that on top. That's right, on top of our baseline shunting, which everybody is doing no matter what. In other words, we said you're shunting 3 to 5% now. We're just going to use 5%. So we're going to show you the calculation, then you're going to take that calculation and you're going to add it to your baseline. You're going to add it on top of your automatic and somewhat normal 5% shunt. Okay, so instead of doing the big formula, what we want to do is do really simply this. You are shunting, and this is very easy, you're shunting an additional 5% for every 100 of A to A gradient. So just to give you an example, and we'll do this on the whiteboard in just a minute. If I calculate your A to A gradient and I find out that it's 200, that's 2 100s. I'm going to give 5% for each of those 100s. So I'm going to say 5% because you have 200s. I'm going to say 5% plus 5%, and that's a total of 10%. Now, you could ask me, is that what their shunt is? Are they shunting 10%? The answer is kind of yes, except I have to get their total shunt by just adding that on top of their baseline, which we're just going to say is 5%. So if your A to A gradient is 200, then your total percent shunt is estimated to be about 15%. All right, well, let's go to the whiteboard and do some of this a little bit more closely. All right, the first thing is, as you look at this, you're going to see the complete shunt formula. And my purpose here is I just want to remind you that the complete shunt formula is really just based upon the fact that the A to A gradient is listed in both the numerator and the denominator. And in terms of that A to A gradient, that's the most important part. That's what we really need to know, this percent shunt. The rest of this, if we were to include like times 0.003, that's in the numerator and the denominator. That's a very small number. If you took any number and times it by 0.003, it would hardly change the number at all. And so this is just really about being specific. It's a very nerdy calculation in the first place. But I've said this in my other formulas. Do you think it matters you're walking down the hall if somebody's shunt is 20% or 20.0526%? And the answer is no. You just care if it's 20, 10, 15, maybe 17%. We care in those swaths. So in mathematics, in the medical world, when we're calculating these things, and especially in the respiratory world, we really don't care about the minute details. Certainly that's nerdy, it's an exact number, but we don't really care about that in healthcare, nor do we care about that if you're taking the NBRC examination, for those of you who are respiratory therapists. I recognize some of you might be nurses and you're working in the ICU, and this is great for you to know the percent shunt, because I'll tell you a secret here at the end of the video as well. Something you can tell about your patients, their acuity level. You'll be able to predict something about your patients when you understand their percent shunt. Okay, so continue on here. There's also another number here, which is the difference between the arterial oxygen and the venous oxygen content. That's also certainly a number that could be part of the equation, but what we find is that that also becomes too small of a number that we don't care about. So to give you an idea, if I were to put that in there, I would maybe change the result by 0.5 or half or less of a percent. We don't care about that. Remember, we care if the shunt's 20, but we really don't care if it's 20.5 or 20.2. And so we can knock that part off as well. All right, and so what we're really saying here is that we don't really care about that kind of thing. This is just too complicated to do. And you know, we really like answers just walking down the hall as we're looking at some blood gas results and a few other of our patients' results to quickly estimate what the percent shunt is. We don't necessarily want to go around the corner and get our calculator out and calculate every single thing, because it doesn't really matter. Now, let me just remind you that if you're on the NBRC examination and you're having to do one of these, the NBRC, the National Board of Respiratory Care, they don't know what you're going to use to calculate or to estimate that percent shunt. Because of that, I want you to keep in mind that they have to give you all of the information. And so you could see a huge list of information. We got barometric pressure, and might have a complete blood gas. You probably will. Got the FiO2 and the hemoglobin, and you got to know the SpO2, but also the venous saturation. And you also have to know the water vapor pressure, lots of things. So the NBRC will give you a bunch of things, and that's kind of intimidating. We only need a few of those things to first calculate the A to A gradient. That's really the alveolar air equation, and then minus what's in the artery. Remember, I've covered that in another video. Just check it out. But once you get the A to A gradient, and sometimes I'm going to tell you, I've been on the examination, they've given me this long list of data And that's intimidating, only to find out that at the very bottom they listed the 8A gradient, and I may have only needed one number. And so I only have to use that. Once you have the 8A gradient, we could do this. Now let me just remind you how we do it, and then of course we'll do that. All right, so let's take a look here. So remember, we're going to do 5% for every 100 of 8A gradient. And so we used as the example, for instance, I said if it's 200, if you have an 8A gradient of 200, well, that's 2 100s, isn't it? That's 2 100s, and we're going to do 5% for each 100, and that means we're going to do 5% and another 5% for the next 100, and that's a total of 10%. And you would think we're done there with the shunt, but you have to remember you're calculating the total shunt, so we have to first add it to the 5% that is really representing the baseline, and that's the amount that somebody is shunting even when they're normal. And so that means the total shunt here is going to be 15%. And so that's a good example. All right, so let's go down and let's do this. I might do the same one, but let's just walk through it just a little bit. Now, if you're watching this as a video, you may want to pause. So here I have an 8A gradient of 200, which we just did. I also have an 8A gradient of 100, then I have an 8A gradient of 400, and we could do 600, 800, doesn't matter. It all works exactly the same. So if you need to, pause the video for a second and try it out. Try it at 200, which we just did, and 100 and 400. All right, but I'm going to assume you've already looked at that, and if you're done pausing or you just want to go on, let's go ahead and just solve this. All right, and so let me get my pens out here. All right, so if we look at this, we have 200, and remember that's 2 100s, right? And what we just said, we're going to give 5% for every 100, and so that's just the same as saying 2 times 5. 2 times 5%, and that's going to equal a total of 10%. But we've got to take that 10% and we have to add the baseline, which we said is 5%. In reality, for everybody, it's 3 to 5%. It just depends on who you are and what's going on inside of you. But again, we don't care about the 2%. We care about if somebody's 10, 20, 30% shunt. We don't care if it's 22 or 21%. So we don't really care. We're just going to say everybody's about 5%. Okay, and so that's how that works. That means the total shunt here, that means the total shunt is going to be a total of 15%. And so this is a 15% total shunt. That's how that works. Well, let's try another one. Okay, so here we're dealing with 100. So I only have one 100, and I'm going to give that 100 5%. And so that's 5% per 100. We only have one of those, so my shunt right now at this point is going to be 5%. The only thing I need to do is add the baseline, which is another 5%. So we have a total shunt of 10%. So it's as easy as that. Okay, but let's do a bigger number now. Here we have 400, and so we have 4 100s. Then I need 5% for each. 5% times 4 of those. And as you can see, that's going to equal 20%. And that's the shunt. But remember, we're looking for the total shunt, and so we have to add the baseline. All right, so after we add a baseline of 5%, then what we're going to get is a 25% total shunt. So calculating this shunt is that easy. You just have to know the 8A gradient, and you can estimate yourself to the correct answer. Now, here's the secret I wanted to tell you for all of you ICU nurses and respiratory therapists who are working in the ICU. This is one of the most important indicators of people who especially are receiving mechanical ventilation. If you were to calculate everybody's shunt, go in the ICU in the morning and line them up, get the data, and calculate all of their shunt, you would literally be able to line those patients up in order of sickness. The people with the shunts that are 10% are going to come off the ventilator much faster, and definitely before those who have a shunt of 15 or 20 or 25 or 30. You're also going to find that those who are shunting 20, 25, 30, those are the people that are very sick and have the high acuity level in your ICU. And if they're shunting more than 30%, they may also not make it off of the ventilator at all. The situation might even end up terminal for them. So it's just a perspective that you can take not only for the acuity, the degree of difficulty or the challenge that that patient will be to you, but the seriousness of their problem is really enfolded in the percent shunt. So it's a great thing to calculate, even if the doctor's not asking you that. Calculate a percent shunt and you'll be able to find out. I'll tell you one other secret. If you're weaning somebody from the ventilator and you've been having trouble with it, or you're about to do that, if you calculate the percent shunt and it is 20% or greater, you probably will not be successful in weaning. And the reason why is because if you're 20%, you have what we call a formal shunt. Of course, you're shunting even with 5%, 10%. But when you get to 20, we're going to call one of your central problems a shunt. That's confusing. I'm going to use the term in both situations. You're shunting no matter what, but when you get to 20%, we're going to say you have a shunt. And what we mean by that is that your alveoli are problematic. And the only thing that's really helping you is PEEP on the ventilator. Now, I'm going a little bit deep here, and so if you're used to working with people on a ventilator, it means if you have somebody with a shunt of 20%, they are PEEP dependent. And it's going to be very difficult to get them off the ventilator because they're going to need that PEEP. And they probably need more than 5 of PEEP. They're probably using PEEPs of 10 or 12 or 15 or even higher. All right, so I'm Dennis from Respiratory Sensei. I hope that's helpful. Please take just a moment, if you would, and smash the like button. I also very much appreciate comments. I look at those. I respond to those. You can tell me what else you want to see or even ask a question, and I'm happy to do that. But also, please subscribe if you don't want to miss any more future videos. So certainly, if you're a respiratory therapist working in the ICU or preparing for your NBRC exam, or if you're a nurse working in critical care with those types of patients, or even a physician, and you want to keep up with what we're looking at here, please follow us and subscribe, and we look forward to seeing you in the future.